All right. Good afternoon, ladies and gentlemen. This is John Randall. I'm Regional Director for GoldenCare USA, and I want to thank everybody in advance for taking time out of their day and jumping onto the webinar. This webinar goes pretty quick. We do have it pre-recorded on our website, goldencareagent.com. Otherwise, notice our phone number up there. If you have any questions, feel free to call in, and one of the marketers or regional directors will take care of you. If you've never been to our website, you should check it out. Look at all those great tools that we have that we offer to our agent to help them increase their sales, generate leads. I really like the care options. That's a great one. The LTC CEO is really good if you're into the long-term care market. And our perfect portfolio is something everybody should carry. The products in the perfect portfolio, so when you run across anybody out there because of health or wealth, we have some kind of answer for them. But today we're going to go over GTL's short-term home health care plan. It's very, very easy to get issued. Near guaranteed issue. It's very flexible. You can sell a real easy, cheap, low plan that's still very effective, or you can build it up and add some extras on there to really give them a powerful plan. So GTL's been around a long time. We've worked with them forever. I'm going to go a little bit over what the product is, where the niche is, some of the plan details, then show you some rates. And again, GTL, we worked with them, or they've been around over 80 years, but we've worked with them for quite a few years. We've sold a lot of their different products. We really love their home health care. They're right out of Chicago in Glenville. So if you look at them, they just got rated up to an A- company. They were a B+. And for a company that doesn't have a huge block of life business, that's almost unheard of to get into the A ratings. So now that they're an A- rating, it opens them up to a lot of people's E&O. They're a great company, and that is very strong to be an A- when you work with an array of products like they have, the cancer plans, critical illness, hospital indemnity, their long-term care alternative, which is either Recover Cash or the critical care. But today we're just going to talk about the standalone home health care. With COVID going on right now, sales are skyrocketing with this. There's a ton of states that it's already in. I'll show you a map later. But you know what? When you decide to add the portfolio plans, the home health care, you might as well add the critical cash and the Recover Cash. If you sell Advantage plans, you want to get into the hospital indemnity. It really plugs the holes on that. And they have a great cancer plan. If you haven't looked at Precision Care yet, there's no other one out there like it. Oops. Let's go right here. The issue age for this is now 61 to 85. They used to go lower in age, but they did raise it to 61. You can get a plan up to $450 a day for 360 days. It has a great restoration of benefit built right into it. They have a great drug plan, and they also help out on the home health care aid side. Right now, the only two questions you really have to answer are currently, are you getting care from home health, nursing home, or assisted living? Or are you unable to perform your activities of daily living or cognitive impaired? If you can say no to both of those, you can get the plan. It's guaranteed. You'll get it. If you have any pre-existing conditions, it will have a 6 months pre-existing condition clause. But that's all it takes to get it. If you want Plan C or the bigger plan, you also have to answer a third question saying in the next 60 days, you don't have any expected to go to a nursing home, assisted living, a hospital, or have a surgery. So it's really nice. It's got some really good add-ons that I'll show you here coming up. But you can trigger it almost like long-term care, where you need help with 2 out of your 6 ADLs. without substantial assistance, or you have a cognitive impairment. The difference is with long-term care, it said, and you're expected to have that for at least 90 days. That's how you trigger a long-term care policy. This one doesn't have that. So you're going to have a lot of people, especially when they get older, that might fall and need some assistance for a while, or they might break their hip, but when they get home, they still need help dressing and bathing, but maybe they're only going to need it for another month after the original treatment. You could trigger this policy, for 1, 2, 3, 4, 5, 6 weeks, then get better. And every time you get better, it's going to restore the benefits. You could use this policy over and over again, and you can get a lot of shorter claims out of it. And obviously, it's still for a full year, but they offer 3 plans, A, B, and C. A, you can get up to $150 a day, B, up to $300 a day, and C, up to $450 a day. And that's a pretty good little pot of money. The maximum benefit period is 360 days, and that is service days, not calendar days. So if you had care 2 or 3 days a week, obviously it's going to last a lot more longer than a year if your situation needs it. So it's 360 days of service. When it says up to $300 a day, if you had a physical therapist and a skilled nurse come in that same day, that would be your $300. If you also had a chemotherapist, they wouldn't pay any more. The most they'll pay in a day is $300. Medical social services, kind of like your care coordinator, they're going to come in at the beginning, make sure the plan of care that you have is good and it'll work and not make the client any worse. But again, just like a care coordinator in long-term care. In some states, they come in once a month. Sometimes they just come in at the beginning. It all depends on what the reason you're on claim for. So most of the time they'll come back once a month or once every 2 months to make sure your care is going as planned. It also has a home health care aid. Plan A is $40, Plan B is $80 a day, and Plan C is $120 a day. And that's extra over and above the other payment for the skilled care. And another nice thing about this plan is there's no prior hospitalization stay in order to get your home health care aid benefit. And again, here you get 60 days of care, and it's not calendar days. Again, it's 60 days of service. So you could easily see where that could be used up real quick, and people would really benefit from having that money coming in when they're receiving care at home. The nice part about this is it also has a built-in prescription drug plan. You can get up to $300 or $600 a year, depending on what plan you get. And it doesn't matter if you have other insurance that pays for your prescription drugs. For every generic drug, you get 10, every brand name, you get 25, and it's every time you refill that, it counts as a new prescription. So if you refill it 12 times a year or each month, that's 12 times. So if you have somebody on prescription drugs, when I show you the cost of these plans later, if they're on a lot of prescription drugs, it's almost a no-brainer to have this plan. And that's why we're selling it so good. So built-in restoration benefits, I already told you about that. How that works is you have to be recovered for 180 days, and you have to have a healthcare practitioner sign off that you no longer required home health care. So that's the trigger to get the restoration of benefits. And again, you can see that that's why you can get multiple claims. The prescription drug, every year, it automatically renews on its own. And there's no limit to the number of times this can restore. So you could use this, 5, 10, 15 times, depends on what happens to you in your life. Because there's no 90-day trigger, You will see a lot more smaller claims before you actually use your bigger claim, or you could see. It's very possible. Now, the optional riders, again, because of COVID, this accident and sickness rider has really picked up. Why? Because it'll give you 100, 200, or even 300 a day for 3 or 6 days of confinement in a hospital. And a lot of the elderly people, are getting fairly sick from the COVID and ending up in the hospital for a while. So this would really help out. Again, all these payments, it doesn't matter if a different insurance is paying it. This pays you regardless. It pays you in cash. You get it. You do what you want with it. So that's happened to be a really good rider right now. It's always been a pretty solid rider. It just seems like in the last year it's picked up a lot of steam. Oops, I skipped one. Then they have a critical accident rider. If you have somebody that's maybe prone to falls or have already bad hips and knees, this might help them if they do, fall and fracture their hip or dislocate their hip. And again, always look at your state that you're in because there's different options that are available of different ones. But it just pays a lump sum. It does have the accidental death built in. You either buy the 5,000 plan or the 10,000 plan. Again, this rider's in its place. The people that know that they need it, it's very good for them. Again, this is accident and sickness is our most popular rider, but they do have a critical accident rider that's probably the next most popular. The ambulance rider, you can use up to 4 times a year. It just pays $200 per trip. There's no hospital required. The lifetime maximum payout is $2,500. It's pretty inexpensive. There's no restoration on it. Once you use the lifetime, it's all done. And we sell some of it. People that want to load up their plans. Again, $200 doesn't go a lot against the actual cost of an ambulance ride. So hopefully they have other insurance that can pay that. The return of premium rider says if you pass away any time before age 86, you'll get all the money you paid in minus any claims paid. It's pretty cheap to add it on, and you didn't come with the original policy, but a lot of people were asking for it, so they did add it. The restriction is they have to die before age 86, or they paid a little extra for the premium and they might not get their money back. The dental vision, I'm not going to go through all of it. You can either get up to $400, $800, or $1,200 a year. It pays a calendar year deductible, and it's limited to the benefits. But each one of the things, the prescription eyewear or the dental cleaning, they all have a certain amount of money they pay, and they give you that again regardless if you have any other insurance. So they have little details for each state on how long you have to wait before you actually can use it. When you first buy the policy, to get bridges and crowns, you have to wait at least 12 months. They don't want somebody buying the policy just to use that, collect all their money, and then drop the policy. So they do make you wait on some of the more advanced treatments, I guess. And same with the vision. They make you wait to get by your eyeglasses or money towards your exam. But again, it paid above and beyond if you have any other insurance. And these benefits do restore each year annually. This is one of the neatest things, I think, is the Ask Mayo Clinic. They have a 24-hour nurse line, and those RNs have an average of 24 years experience. When you buy this policy, you automatically have this free. It comes with the policy. They also have Ask Mayo Clinic online, where you can go online. It's very secure, private, and you can get easy assessment for a lot of symptoms you might have. And you're talking about the Mayo Clinic here. You're getting really good advice. And then the critical illness support is like a second option. Your doctor tells you, here's what's going to happen, here's what you need. You can call them and they can tell you, yes, that sounds like a good idea, or hey, maybe ask your doctor to do this. And you know what? 98% of callers report a high level of satisfaction with Ask Mayo. So think of having the Ask Mayo Clinic by your bedside. That's worth a lot of money in itself. So I think it was great for them to add that on, and I think all the clients that have used it so far really like it. Right now it's approved in 35 states plus the District of Columbia, and you can see the map here. And I believe they're going to send out this PowerPoint to you so you can be able to tell if your state's involved. Really, to do the rates, it's very easy. You just look at the worksheet, and I don't have one up here, but it's just age rated. If you're age 62, here's your cost. If you're going to add any riders, you add that price to it, and there's your price. It is age banded, so every 5 years you're going to move up to the next age rated. But let's take a look at a 61-year-old really quick and how you can make it very affordable. For $19.42 a month, you know what? That's $253 a year. And you know what? You get $300 back in prescription drug company. So if you had this plan in this state and you were on enough prescription drugs, they're going to pay you to have that plan. I mean, you just can't beat that. And this is another reason why we're selling so much of it. That's a nice little plan. It gives you up to $54,000, up to $150 a day, $40 a day for home health care. You get up to $300 back on your prescription drug, and it has restoration of benefits. But then you can go very robust. And you can do the plan C, that's going to give you $162,000 max, $450 a day, $120 in the home health care aid, which is an extra $7,200. You have a prescription drug benefit of $600 a year. It does have the return of premium, so if you pass away before age 86, you get all your premium dollars back minus claims paid. It has $300 a day for up to 6 days of the hospital, up to $10,000 for the critical accident, the $2,500 ambulance, and the $1,200 dental vision rider. So basically loaded up, and look at that, still very affordable, $1,776 a year. If they're taking enough prescriptions, you can knock $600 off, $1,176. That's basically, I just want to show you how you can basically go anywhere from $253 to $1,776 for this age 61-year-old. It'll be higher and lower in different states. I know North Carolina is one of the most inexpensive states. South Carolina is fairly cheap. Kentucky's really cheap, but it doesn't have the prescription drug rider on it. And that's probably why that one's so cheap. And then I'm just going to give you a quick sales idea. If you're not familiar with our critical cash is long-term care on a critical illness rider. So this one would pay $24,000 lump sum diagnosis right away when you get diagnosed with something. If you had to go to an assisted living, you'd get $25 extra a month for 24 months, or if you had to go to the nursing home, $5,000 extra a month for the nursing home benefit. It has a huge pool of money, $432,000. You can use it over and over and over again till you use that whole pool of money. And you know what? That's a very good plan for $130 a month. Then they add the extra, the long-term care, or the Plan C to it to give you $450 a day. They didn't put all the extra riders, but they did some of them. And look at that, for another $53.11 a month, you add the two together and you have two great plans. They both pay cash. They both pay regardless if anybody else pays. And it gives a lot of peace of mind. So I was just trying to show you here that the other GTL products are really nice and they definitely have their place too. Here's a look at what the pricing looks like. So 61 to 74, $19 a month, or up to $443 a month with no riders. They also have an annual chart, so it's real easy to price this. You can just look at the person's age and say, here's what the base plan is going to cost. And the base plan, again, is the 150, 300, or 450 in skilled care, and the 40, 80, 120 in the home health care aid, plus the prescription drug. That's all in the base plan. I want to thank everybody for joining us today. I went through it fairly quick, but I think you'll see that it's a fairly easy product to pick up on. If you do have some questions, make sure you give us a call. But I just want to thank everybody again for taking time out of their day. I hope you picked up something on this. Again, on our website, GoldenCareAgent.com. You can see all the tools that we offer free. If you go to the top training, you can actually watch a recording of any of our webinars that we've done. If you didn't hear Steve Moses give the end of the year update, that is recorded on there. But feel free to give us a call, 800-842-7799. Everybody have a great day. Enjoy the rest of their week. Stay safe. Take care.
Check out our website, GoldenCareAgent.com, or give us a call at 800-842-7799.